Autism spectrum disorder is a serious neurodevelopmental disorder that impairs a child's ability to communicate and interact with others. It also includes restricted repetitive behaviors, interests and activities. These issues cause significant impairment in social, occupational and other areas of functioning. Please like, share, comment and subscribe. Thank you for your love and support. Autism spectrum disorder (ASD) is now defined by the American Psychiatric Association's Diagnosis and Statistical Manual of Mental Disorders (DSM-5) as a single disorder that includes disorders that were previously considered separate: autism, Asperger's syndrome, childhood disintegrative disorder and pervasive developmental disorder not otherwise specified. The term spectrum in autism spectrum disorder refers to the wide range of symptoms and severity. Although the term Asperger's syndrome is no longer in the DSM, some people still use the term, which is generally thought to be at the mild end of autism spectrum disorder. The number of children diagnosed with autism spectrum disorder is rising. It's not clear whether this is due to better detection and reporting or a real increase in the number of cases, or both. While there is no cure for autism spectrum disorder, intensive, early treatment can make a big difference in the lives of many children. Autism spectrum disorder impacts how a child perceives and socializes with others, causing problems in crucial areas of development, social interaction, communication and behavior. Some children show signs of ASD in early infancy. Other children may develop normally for the first few months or years of life, but then suddenly become withdrawn or aggressive or lose language skills they've already acquired. Each child with ASD is likely to have a unique pattern of behavior and level of severity, from low functioning to high functioning. Severity is based on social communication impairments and the restrictive and repetitive nature of behaviors, along with how these impact the ability to function. Because of the unique mixture of symptoms shown in each child, severity level can sometimes be difficult to determine. However, within the range spectrum of symptoms, below are some common ASD actions and behaviors. Social communication and interaction: fails to respond to his or her name or appears not to hear you at times. Resists cuddling and holding and seems to prefer playing alone, retreats into his or her own world. Has poor eye contact and lacks facial expression. Doesn't speak or has delayed speech, or may lose previous ability to say words or sentences. Can't start a conversation or keep one going, or may only start a conversation to make requests or label items. Speaks with an abnormal tone or rhythm, may use a sing-song voice or robot-like speech. May repeat words or phrases verbatim, but doesn't understand how to use them. Doesn't appear to understand simple questions or directions. Doesn't express emotions or feelings and appears unaware of others' feelings. Doesn't point at or bring objects to share interest. Inappropriately approaches a social interaction by being passive, aggressive or disruptive. Patterns of behavior. Performs repetitive movements, such as rocking, spinning or hand flapping, or may perform activities that could cause harm, such as head banging. Develops specific routines or rituals and becomes disturbed at the slightest change. Moves constantly. May be uncooperative or resistant to change. Has problems with coordination or has odd movement patterns, such as clumsiness or walking on toes, and has odd, stiff or exaggerated body language. May be fascinated by details of an object, such as the spinning wheels of a toy car, but doesn't understand the big picture of the subject. May be unusually sensitive to light, sound and touch, and yet oblivious to pain. Does not engage in imitative or make-believe play. May become fixated on an object or activity with abnormal intensity or focus. May have odd food preferences, such as eating only a few foods, or eating only foods with a certain texture. Autism spectrum disorder has no single known cause. Given the complexity of the disorder, and the fact that symptoms and severity vary, there are probably many causes. Both genetics and environment may play a role. Genetic problems. Several different genes appear to be involved in autism spectrum disorder. For some children, autism spectrum disorder can be associated with a genetic disorder, such as Rett syndrome or Fragile X syndrome. For others, genetic changes may make a child more susceptible to autism spectrum disorder or create environmental risk factors. Still, other genes may affect brain development or the way that brain cells communicate, or they may determine the severity of symptoms. Some genetic problems seem to be inherited, while others happen spontaneously. Environmental factors. Researchers are currently exploring whether such factors as viral infections, complications during pregnancy, or air pollutants play a role in triggering autism spectrum disorder. Because ASD varies widely in severity, making a diagnosis may be difficult. There isn't a specific medical test to determine the disorder. Instead, a specialist in ASD may observe your child and ask how your child's social interactions, communication skills and behavior have developed and changed over time. Give your child tests covering speech, language, developmental level, and social and behavioral issues. Present structured social and communication interactions to your child and score the performance. Include other specialists in determining a diagnosis. Recommend genetic testing to identify whether your child has a genetic disorder such as Fragile X syndrome. No cure exists for autism spectrum disorder, and there is no one-size-fits-all treatment. The range of home-based and school-based treatments and interventions for ASD can be overwhelming. The goal of treatment is to maximize your child's ability to function by reducing ASD symptoms and supporting development and learning. Your healthcare provider can help identify resources in your area. Treatment options may include behavior and communication therapies. Many programs address the range of social, language and behavioral difficulties associated with ASD. Some programs focus on reducing problem behaviors and teaching new skills. Others focus on teaching children how to act in social situations or how to communicate better with others. Though children don't always outgrow ASD symptoms, they may learn to function well. Educational therapies. Children with ASD often respond well to highly structured educational programs. Successful programs often include a team of specialists and a variety of activities to improve social skills, communication and behavior. Preschool children who receive intensive, individualized behavioral interventions often show good progress. Family therapies. Parents and other family members can learn how to play and interact with their children in ways that promote social interaction skills, manage problem behaviors, and teach daily living skills and communication. Medications. No medication can improve the core signs of ASD, but certain medications can help control symptoms. For example, antidepressants may be prescribed for anxiety, and antipsychotic drugs are sometimes used to treat severe behavioral problems. Other medications may be prescribed if your child is hyperactive. Managing other medical conditions. Children with autism spectrum disorder may also have other medical issues, such as epilepsy, sleep disorders, limited food preferences or stomach problems. Ask your child's doctor how to best manage these conditions together.